This is Jerry Hesch from the Hesch Institute in Aurora, Colorado. And my client Amy flew in from where?
South Carolina.
South Carolina to see me for treatment. How many people have told you that you have an anterior ilium?
Probably 3.
Okay, and so the definition of an anterior ilium is supposedly rotation of the right half of the pelvis on the sacrum, but that's a false paradigm. If that were true, then there would be a rotation happening in the pubic joint, and your pubic joint is completely symmetrical. Okay? An anterior ilium can actually be a rotation of the whole pelvis on the hip joints. And that's what very few clinicians understand. Now, your pelvis is asymmetrical, but it's not because your ilium is rotated. And it's not because the pelvis is rotated. Your ilium is lower on the right side of your body because the bones grew that way. Okay? When I test mobility in multiple directions through your pelvis, you have normal mobility today. But you still have asymmetry, and that's how I know that it was developmental. I can't change it.
Got ya.
Okay? You've been doing a biomechanically sound correction for a so-called anterior ilium, okay? And it's not changing how your pelvis presents. So in standing, it's not subtle, okay? The right side is lower, okay? Now, for that reason, you were given a heel lift.
Correct.
All right? How many different practitioners gave you a heel lift?
Just the one.
Alrighty, okay. So let's have you lie on your back.
Okay.
And then put your legs out straight, please. Good. So when I make sure you're lying pretty symmetrical on the table. And when I bring your feet together and look at your medial malleoli, and then I bring your ankles into neutral and I look at the heels, they are symmetrical. So you don't have a leg length difference. Now, what's interesting to note is that your patella is lower on the right. Considerably so. It's not subtle. Now, it's not because the patella has a movement problem, because I can spring it inferiorly. It has good spring, and I can spring it upward. So it's not pulled down. It's a normal functioning patella, but you actually do have a leg length difference, but it ends up being equal because you have a longer right femur, but you have a taller left tibia. So they balance. Now, even with you laying on your back, the pelvis is still asymmetrical, as it is in standing. If you would bend your knees and keep your feet flat, and scoot your left foot forward by 1 inch, and make your feet touch each other, and then bring your left foot forward by 1/4 of an inch, and now 1/8 of an inch, 1/16 of an inch. Slightly more. One more time, 1/16 of an inch forward. Okay, keep going till you touch me. Got it. Got it. Bingo, we're good. All right. Now, so this is the left knee. These wouldn't roll up with it, but can I lift yours up past your knee, please? So that'll give us a nice contrast.
Okay.
Beautiful. All right, that's really helpful. So what do we see here? What we see is that this right femur is longer than this one. Okay? And then from another angle, from down here, the left tibia is taller. Okay? But again, when you lay on your back and when you stand, they balance out. When does this become relevant? And the answer is, it becomes relevant when you sit. So let's have you come sit in the chair.
Okay.
And bring your feet together.
Okay.
And because your ilium on the right side is lower developmentally, your pelvis is asymmetrical by design.
Okay.
Okay, that's not something any clinician can help. It's in the bones. All right. So when you sit on a symmetrical surface, the chair is trying to force you into symmetry, but you don't have symmetry.
Right.
Okay. So for improved sitting comfort, what you can do is raise the right side of your body by sitting on, we're going to use a notepad right now, and I'll
Okay.
go grab a piece of craft foam. So you a little deeper.
Okay.
So you put that under your right sit bone. How do you feel when you sit on that?
Better.
Okay. Where is it better and how is it better?
It just feels like the whole base has got support, where before it feels off.
Okay. So let's look at your pelvis now.
Okay.
You know, much improved symmetry. Okay? When you're off that, it's obvious in sitting. Let me take this out. I looked at you a while ago.
Okay.
Okay? It's obvious that you're lower on the right side.
Got ya.
So it makes a big difference.
Yeah.
And it's interesting because the asymmetry seems more than 1/4 of an inch, and yet you sit on 1/4 inch under the ischial tuberosity, and then it makes a big difference. So that's kind of a multiplier effect, sort of.
Interesting.
Yeah. So what I like is this craft foam,
Okay.
and 6 millimeters is 1/4 of an inch. You can buy this craft foam in 5 millimeter, or you could buy 2 3s, 3 millimeters. Okay. I found this at Joann's craft store, but Michael's carries it, Hobby Lobby carries it, and it's called craft foam. The brand name of this one is Creatology Foam Sheet. Okay, and this will hold up beautifully.
Okay.
It has very minimal compression. So you could buy one of these and you could cut it in 4 and keep one in the car, so when you go to a restaurant you can sit on it. You know, keep one under your office chair. You could even tape it to the chair if you want.
Yeah.
So that is how we can deal with a developmental asymmetry of the pelvis. Now, for some individuals in which there's a significant asymmetry, typically someone with significant scoliosis,
Yeah.
then what we also do is we experiment by putting craft foam behind the ilium. What does that feel like?
I don't know if I feel a difference.
Okay, let's try it on the other side.
It feels odd.
Yeah, so it's not needed.
Yeah.
Okay, so you don't need that. It's rarely needed unless someone has moderate to severe scoliosis. So this is my summary of how someone was given a heel lift on the basis of looking at you, I believe, in standing.
Yeah.
Okay, and that's a false paradigm. And then therapists have been treating you for an anterior ilium, but it's based on tests that are not really good. Am I correct? Did they have you do this marching?
I didn't do that.
No? Or they just looked at your pelvis?
Yeah.
Yeah, and see, that's not enough to look at how something looks and then say it has a movement problem.
Right.
Okay, go ahead and lie on your back.
Okay.
A better way, so roll over.
Oh, sorry.
A better way to test if motion is lost, that is treatable, usually, is to do a posterior rotational spring test. And you'll notice that I can take up the slack, so I can push this to a point where it stops, and then I can spring it, and it springs forward and it bounces right back. So you have normal mobility of this structure today. Okay, but again, it's asymmetrical. So that's a passive movement test to see if motion is lost, and if it is lost, then that's usually treatable.
Okay.
Okay. Lie on your stomach, please. And the other test for this so-called anterior ilium is to spring it inferiorly, and you have good mobility there, good spring and good recoil. Interestingly, the back of your pelvis is rather symmetrical. If there's any asymmetry, it's too subtle for me to see with my eyes. But in the front, it's very, very apparent. So this has been an informative video on contrasting how something appears, or alignment, or malalignment, misalignment. That is due to a developmental asymmetry of the bony pelvis, and how heel lifts are not effective in treating this. But in sitting on a 1/4 inch lift under the right ischium felt more comfortable. Thanks for letting me film this and share it.